We've been talking about a lot of positive things with home-based cardiac rehab, and it sounds too good to be true. So what's hard about doing this? What are the challenges you're experiencing? And as you think about going from where you are now, which is kind of, you've piloted this and you're thinking about how to grow it, what do you think is really going to take that isn't there today to make that happen? I think we can start.
I think not really seeing them in person and how they're doing when they're exercising, you kind of just have to take their word for it. So when we bring them into the program, we really emphasize letting us know about symptoms and reporting their rate of perceived exertion and really kind of getting good at monitoring themselves, taking their own pulse, why that's important, and communicating with us when things are happening.
Cool.
Yeah, I think one of the challenges has been, a couple of things. From the patient perspective, I think identifying the right patient for this kind of a program. There's a patient who wants to do this because they are really internally motivated and they do like the independence, and they still like, they like the safety of checking in, but they like the independence. And then there are patients who, quite honestly, want to say they want to do it because they really don't want to do it, if that makes sense. It's like, yeah, I'll just do 1 day a week, but then they really don't want to be compliant. So I think identifying, we do risk stratification for event, but I think almost like a risk stratification for compliance has been something that's been a little bit challenging for us. The other thing from a program perspective that we found actually quite challenging, because we have already a traditional program and it's, we have a lot of history and it's strong, has really been figuring out sort of the right marketing, internal and external marketing for this type of program. I hear, I tried scripting for the secretaries, and I hear them like they struggle. They don't really want to offer it on the phone because they're not familiar enough. And the same actually with the staff. We just talked about it again at our meeting last week, and it's kind of like, well, when should I offer it? If I have this patient who says they're going to drop out, is that a good time? So, and I take that on. I mean, I feel like we just, we need to sort of tighten that up. So that's been challenging for us, is finding the right way to communicate to really invite people into this option. So that's something that we're still working on.
And I guess reimbursements, that's still a big challenge, right?
Yeah, I mean, reimbursement or lack of is a challenge, but I think because we still, in our model, bring people in once a week, I still believe it's better to bring them in once a week than to have them completely drop off. So, we're not, I think that was another question that came from my team is, are they taking a spot, if you will, because we don't do an open gym concept. So, if we can take up to so many patients, are they taking a spot, and now we have 2 days a week that nobody's in that spot. So that's been also sort of a shift in communication, that this is kind of an add-on, if you will, that I understand and recognize that it's additional documentation, it's another patient you're managing, but it's really one more at that time, and not somebody who's taking a spot where you could be charging 3 days a week. So I would say right now the reimbursement is less of an issue.
Okay, that's good to know.